and it made a big difference in our recovery. So, Stefan, you have a lot going on, and I'm really pleased to have you present today. So with that, I'll stop talking.
All right, everyone, I'm Stefan Hartman. I'm a PA. I'm owner of Iron Direct Primary Care here in Florida. And we are licensed in quite a few states. We're launching a satellite clinic in Michigan. So we got a lot going on. As Dr. Lewis said, we also have something called the Human Performance Arena here. It's a private gym with a cryo pool and a sauna, infrared lights. So we got a lot of things going on here. But today's topic is iodine for chronic disease prevention and management. And if everyone can mute themselves if they're not speaking, we'll have questions at the end. So I've identified that iodine deficiency is as rampant as vitamin D deficiency. This is based off of personal research I've conducted at my office. So I randomly selected 42, we're up to about 45 patients right now, and I did serum iodine levels on them. I drew it. And everyone was deficient. The reference range is between 40 and 100. Everyone's sitting at around 41 or sometimes below that. And this is all patients, right? Young, old, athletes, bodybuilders, frail, elderly, healthy. It doesn't matter. Everyone is low, as you can see here. We have 35, 28. This is an athlete, older people. Chronic diseases, 41. No one can hit a high level. And as we know with vitamin D, the reference range is almost similar, right? The reference range is like 30 to 100. Okay, so similar kind of.
Just I don't want to butt in, but I see healthy people or a very health conscious people, and I see the same thing with T3. They're in the lower 25. Most, I would say 75% are in the lower 25 percentile of T3.
Too. Yeah, and we're gonna get to why that is right now. It's related to iodine, and everyone will pull up their multivitamin and they'll be like, oh, I got 150 micrograms here. It says it's 200% of the daily value, and they'll think they're good, okay? And then their iodine levels are this, right? The WHO FDA recommendation for iodine is based off some 1900s recommendation to prevent goiter in individuals. But as a provider and patient, if you really learn the power of iodine, you're going to be a hero. People are going to start feeling amazing. It's a cheap test to do. You can prove it to yourself. You can get a serum lab draw for iodine. But we're also going to talk about some advanced level testing that may be a little bit more helpful at assessing the dose of iodine that you need. This is based off some of the literature that Dr. Brownstein has done. I think you guys have had him on your program here.
Yep.
I'm going to give you guys a couple case studies as well to kind of put this into practical applications for you. So this is a 12-year-old girl. She had breast pain and hardness. I advised her to paint Lugol's iodine to the breast daily, and the symptoms resolved within 3 days, okay? And here's a visual representation of what some of these levels might look like. Here's an iodine level of 41 and a vitamin D of 23. That's actually not quite uncommon, these very low levels. Mm-hmm. This is what I was taught in school is iodine deficiency. They showed me a picture of a third world patient, Africa or India or somewhere, and they had this big neck, and that's called a goiter. And that's why the iodine recommendation was added to the salt back in the 1900s. It was to prevent this, and it did so fairly well. We don't see people with these big masses in the US anymore, but a lot of patients do still have goiters. It may not just be so obvious. If you think about where we might be getting iodine, we don't really get it into the American diet. No one's eating kelp, seaweeds, which are high iodine sources of foods. Shellfish does have some degree of iodine, but most people don't eat shellfish on a regular basis. This is a screenshot from Brownstein's book, Iodine and Why We Need It. And he also discusses a lot of the falling levels of iodine. Specifically iodine levels falling in women of childbearing age, which we're going to get to in a little bit. So here's some mechanisms of action. I give these lectures at a high level for Dr. Halassa's group, but let's just talk about this and put it into perspective, because as Dr. Lewis suggested here, iodine is critical towards thyroid function, but also for these negative feedback loops, your pituitary as well. So the pituitary gland here, it's at the bottom of your brain, secretes thyroid stimulating hormone, which stimulates iodine trapping, thyroid hormone synthesis, and the release of T4 and T3 by the thyroid gland. So if you look at your T3 and T4 levels, you're probably going to be low. I see this every day in practice. I'd say about 90% of the patients that come to me that I draw levels on, they have very low T3 and T4. They're not optimized.
Agreed.
And Thomas has found this as well. Let's take a look at this very interesting case here. So this is a patient with an elevated IGF-1 level. She was sitting 350 to 374. We were about to send this girl for an MRI of her brain because we were worried that she had a pituitary adenoma. But if you remember from our previous slide there is a feedback mechanism to the pituitary. I have a hypothesis that iodine also plays a role on the pituitary. This girl's IGF-1 normalized down to 296. She hadn't been like this in years, just giving her back low doses of iodine, low doses being about 3 milligrams a day. Okay, this is a lady, she's overweight as well, low energy, she grows cystic infections, a lot of signs of iodine deficiency. So people will ask, what are the safety issues with iodine? Why isn't this recommended more? Is iodine safe in pregnancy and children? Oh, I'm glad you asked. Let's talk about this. So placental tissue iodine levels and blood magnesium concentration in preeclamptic and normal pregnancy. So they identified here that placental tissues in preeclamptic women had very low iodine concentrations, and that iodine plays a role in magnesium as well. So we know the treatment for preeclampsia often is like IV magnesium, and that is used in the acute setting for preeclampsia. But we should be recognizing that developing a fetus and women in general have high iodine needs, and we should be giving them iodine early. And this lecture will talk about more things like this. The common knowledge is iodine only plays a role on the thyroid, and that's true. It has a huge role on the thyroid, but there's many other applications for iodine. We're going to talk about prevention in at least 5 different cancers with iodine, specifically of the breast, the uterus, the ovaries, the thyroid, obviously, and the prostate in men. All of these are iodine-sensitive organs. And without iodine, they develop proliferation, growths, and tumors, and abnormal function. But another important thing is the hyperestrogenic state. For those of us in anti-aging medicine who run the hormone panels, we see an epidemic of estrogen dominance in both men and women, and low progesterone in women, and infertility in women. This is an epidemic, and it may be related to an iodine deficiency. So here's a little bit more about that. I have a picture of Aragorn here. He's a hero with the iodine. So here's some more screenshots from Brownstein. Brownstein suggests that has many more applications, anything from chronic pain or chronic pain management. Doctors may be interested in this for fibromyalgia. I've seen personally it improve dysmenorrhea in women. So pain of the uterus every month, just a couple of drops of iodine improves this. And also fibrocystic breast disease, painful breast tissues. So it can help with pain management as well. Dr. Reddy brought me onto this one. This is what Dr. Tom Lewis was talking about earlier. Dr. Reddy, she brought me onto her book, which is the mouse mammary tumor virus that infects human cells in the breast. She wrote a whole book on this thing if you're interested in it. But what she sent me has this thing is how iodide has application for diminishing mammary dysplasia and atypia, which means abnormal growths of the breast tissues. So iodide induces cell death as well as autophagic response, which is the ability for the body to eat up cancerous cells and turn them over. However, this is not common knowledge among surgeons, breast surgeons. Dr. Reddy told me this, and I experienced this myself at a recent conference I went to. I went to a dinner, and 2 surgeons were trying to sell me on their breast surgeries and their mammograms. And I asked them, what do you know about iodine and its role in breast disease? And they're like, we don't know this. Show us the evidence. There's actually quite a lot of evidence in support of iodine in the reduction of breast cancer, but it's not mainstream evidence. And it doesn't sell surgeries.
Well, anecdotally, just looking at Japanese populations. So,
yes, we'll get to that in a second.
No doubt, I won't.
No doubt. So this is the picture I was shown in school. This child here, it looks like a fat child. I was told that this was cretinism, and this only happens in Africa and third world countries, right? And this is an iodine deficiency. However, I think this applies to a lot of the American population. The children that you need, they can have this cretinoid appearance. They're swollen in their face, their IQ is lowered, they have more attention problems in school, failing on tests, etc. So I think this iodine deficiency is not a third world problem. It is here in the US and so-called advanced countries because of the iodine deficiency. So this was an interesting study. Fibrocystic breast disease, a very painful condition, quite common in young women. They get painful breasts. Very, very readily, you can rectify this with iodine and iodide. So this means 2% Lugol's iodine or iodoral. And this study showed that these subjects, this was done, I think this was done quite some time ago by William Gent. And it showed that this rectified fibrocystic breast disease, right? And what is the common treatment for that? Take some ibuprofen and so forth. So we can take a natural substance and improve this disease. And this is proven in the literature. So at least we got one really well-established way to fix the problem. This is what I found in my practice. I had this case. Mastitis is a breastfeeding mom. She had a mastitis infection of the breast. And this was before I knew about iodine or actually believed in iodine so much. So I prescribed her ampicillin and I was like, listen, you can try applying some Lugol's iodine. I read some studies that maybe this might help, but I'm sure you'll need this ampicillin. But sure enough, she started applying a topical Lugol's and the infection went away quite readily. And she never needed to take the ampicillin. So this was kind of shocking to me, who still didn't believe so much in the power of Lugol's iodine. But we learned in the pandemic from Dr. Peter McCullough how intranasal providone iodine is antimicrobial. It is antiviral. It is antibacterial. And surgeons have known this for years as antibacterial, right? You apply it onto the wound before you make the incision in a surgery. But Peter McCullough has told us this, and so we've been using it in all our COVID protocols to kill viral particles on contact to reduce the viral burden in the nasopharynx. So this is well established for its antimicrobial purposes. Interesting, we can look at a lot of animal data. It seems like our farmers are way ahead of us than we are. They know that if the cow is developing uterine cysts, that you give it iodine in the feed, and the uterine cysts will go away. But this is not mainstream knowledge. If you have uterine cysts, the treatment is most likely observation until they grow enough for surgery, and then you get surgical removal of the ovarian cysts. So this is a patient I talked to recently. She's a 34-year-old female. I put her on 50 milligrams of iodoral. This was based off some imaging I had done that showed large cysts of her uterus, and they were giving her pain. She would wake up at 2 a.m. every morning in severe pain. This has been going on for quite some time. After just 2 or so weeks of the iodoral, she said she was sleeping better, no more pain. She has had no side effects from this dose of iodoral, and we're going to continue this until repeat imaging shows resolution of the cysts. Iodine and breast disease. We just had Breast Cancer Awareness Month. If you shared a ribbon on Instagram without sharing iodine, do it. Share iodine. It's well established that iodine, interestingly enough, lactation is protective against breast cancer. Now, why that might be is because iodine has highly concentrated in the breast milk. It goes to the child. Thus, the breastfeeding mother has high requirements for iodine, as does the developing child. Here's another interesting case for us in anti-aging medicine. We had a 64-year-old female on estradiol, TRT, and progesterone. Doing this, we induced a little bit of breast tenderness. So she was getting that thing that the younger women get with the breast tenderness. So what we did is we gave her some iodine, and lo and behold, her breast tenderness improved quite rapidly, right? This is because estrogen needs iodine to metabolize properly. Otherwise, it can accumulate and you can get a bit of estrogen dominance. Iodine requirements of the breast tissue are great, especially in the developing female. So younger women, growing breasts require more iodine. This is another case of a 34-year-old female. She had ovarian cysts. They were giving her pain. We had her apply Lugol's iodine topically. The pain resolved. This is another lady. She's 30 years old, chronic uterine cramps for years, premenstrual dysphoria. That's a label we give to women in psychiatry that says they're crazy because they're menstruating. History of goiter, colloidal cysts of the thyroid at an old primary care that never spoke to them about iodine. She's always had to take about 800 milligrams of ibuprofen every month to treat the pain. We gave her about 3 drops of Lugol's iodine every day. This is the first time that she can remember in over a decade that she's not had to take ibuprofen. She no longer has the premenstrual dysphoric disorder. It went away. She's feeling great. So this is a superb example of why women need this. Yes, seaweed. We can talk about the Japanese. They have a high intake of seaweed. This is some traditional Japanese foods. We can see a bit of kombu here, some kelp. I had this growing up as a child. My parents were really into macrobiotic foods, so I ate a lot of seaweed growing up. Let's talk about the periodic table of the elements and a quiz for you guys. Out of the halogens, which one is the most powerful oxidizing agent? You can see here the periodic table. We have fluorine at the top, chlorine, bromine, and iodine here at the bottom. Can you guess which one has most affinity for your tissues? It is fluorine. Fluorine is the most powerful oxidizing agent because it's the most electronegative element. This means it binds to your tissues way more readily than iodine. So again, fluoride, and you may have been told by your dentist that you need fluoride to help your teeth. But for those of us who follow the research of Weston A. Price, we know this is a fallacy. You do not need fluoride to strengthen your teeth. This is based off of very poor data, and it's been a massive government experiment on the population that we didn't ask for. It's in your tap water. It's in a lot of your pharmaceutical medicines. Fluorine binds to your thyroid and your tissues more readily than iodine. So iodine never even has a chance to bind to your thyroid in the first place. That little 150 micrograms in your multivitamin never has a chance. It's not there. So why is fluorine in healthcare? So this is going to shock a lot of you. It's in 30% of the blockbuster drugs you might be prescribed. The reason they did this is because fluorine makes it more effective, specifically steroids like prednisone and so forth. It's high in fluorine atoms, and it makes it work better. So it's, unfortunately, it's in a lot of our drugs. Here's some of the common drugs that you can find with fluorine atoms in it. You may recognize a couple of these that you may be taking. We know that Cipro is bad news. It's a fluoroquinolone, FLU, fluoro. Does that give you a hint? It's fluoride, fluorine. And that may be why people have such bad time with fluoroquinolone type antibiotics, is because of the fluorine in there. Here's another one, Flonase. It's over the counter now. You can shoot fluoride right up into your pineal gland. So beware of that. Lipitor, a lot of you guys. What's that?
One interjection. What people should definitely try to stay away from the fluoroquinolones because they have black box warnings on them. Mm-hmm. But doctors very rarely tell you that, as it is still the first line treatment for some practices out there. And that should be one of the very last antibiotics that people should get. But again, the public doesn't really know this, but there's a whole group of individuals, they're called floxies, and they've had massive injuries from these antibiotics.
Massive injuries. I have a guy who he went to the ER for COVID treatment. They gave him like a Keflex, right, an antibiotic for COVID, nonsense. He got sick, so he went back and like, oh, we're gonna hit you with the real deal. They gave him Levaquin. He ended up blowing out his aorta. His aorta literally disintegrated. He was in like a 24-hour operation. They were trying to piece back together his aorta because the fluoroquinolone, it disintegrated his connective tissue of his aorta. And no one put this together,
Absolutely.
but I'm quite certain that's what happened.
Yeah, yeah.
Fluoride as it relates to the diabetics. So there's a large body of evidence of harms associated with fluoride, and it also potentially induces diabetes. So we know the statin drugs, if you put someone on a statin, they have increased risk of developing diabetes. Potentially, it could be fluoride as the causative agent for this. This is the Japanese anime Demon Slayer, demonstrating the traditional popular consumption of kelp. So Japanese will consume at least 3 milligrams, if not on average 12 milligrams of iodine every day. That's low estimate. Some suggest they eat up to 45 milligrams of iodine sometimes. The Japanese population has much less risk of all those cancers, the breast, the prostate, the uterine, the ovarian cancers. And they have generally better health in America. So do children need iodine as well? Yes. And then those proponents, friends of mine, and the ancestral diet, I think it's a great diet. They say all you need is meat. You don't need any supplements. Unfortunately, there's minimal iodine in meat products. So even our carnivore friends will be deficient in the iodine, and you can often see their thyroid shutting down. Paul Saladino, he's demonstrated his thyroid shutting down and so forth. I would suggest that my friends, my carnivore friends, look at iodine levels in themselves and add it into their diets. We have to talk about potassium bromate toxicity next. So here's some common symptoms of bromate toxicity: abdominal pain, kidney disorder, dizziness, cough. That's a problem. Bromide has been added to bakery products as of the 1960s, 1965s, thanks to medical iodophobia. That's medical practitioners like me telling people not to consume iodine. They replaced iodine as an anti-caking agent in bread products with bromide, a toxic halogen that has cancerous applications in the body. So if you go to a store and you get bread products, commercial bread products, it probably has bromide in there, okay? So this is, I met this statue down in Florence, Italy. This is one of the Medici. He has the buggy eyes. That's classic of exophthalmos. That's what I was taught in school. It said if I told a patient to take iodine, they would get the exophthalmos, they would get thyroid storm, Graves' disease, arrhythmias. They'd die. I was so scared of giving patients iodine graduating from school. Here's a pretty grim report card. This is based out of India. India and the US are the only two countries that haven't banned bromate. So bromate is still used extensively in the bread products over there. It's banned in the European Union. Here's more about bromide in bread, how it came to be. It's been in the bread system for about 90 years or 100 years. It develops renal cell tumors, mesotheliomas, thyroid follicular cell tumors in rats. However, the FDA must be watching my lectures because this week they proposed to ban bromide as an additive in food. It must be paying attention or something. Took them long enough, only took them a century to figure this out. So it looks like they might be moving to ban bromide in common ingredients found in the store. So I thought that was funny. So let's talk about this. This is the 24-hour urinary iodine challenge. I learned about this from Dr. Brownstein. I read his book. This is my test. This is me here. So this is how it works. You get this container and you got 2 tubes. You wake up in the morning and you urinate. You put it in 1 tube. You label it as a pre-test. And then you take 50 milligrams of iodoral, like this. It's a big horse pill. You take one of those, and for the next 24 hours, you capture all of your urine in a big container. The next morning, you shake it up and you put it in a tube and you ship it off to the lab, okay? This is my results. My pre-test showed that I was low in iodine at baseline 0.1. So I don't have much iodine to excrete at baseline. At the end of taking 50 milligrams of iodine, 24 hours later, I had 38 milligrams excreted in my urine. That tells me that my dose is approximately 12 milligrams that I should be taking every day. So I had an excretion rate of 76%. That's not too bad. Mind you, I had been taking 2% Lugol's iodine in the preceding months because I identified that my thyroid was shutting down. But before this test, you have to stop that for 5 days, no iodine for 5 days. It showed that I was excreting bromine, so 7.7 milligrams of bromine, which I was quite shocked to see. I thought I was doing good. I thought I was selecting good bread products, but I still have some bromine to detoxify. It could be just that I'm harboring this in my body and I need 50 milligrams of iodine to dislodge 7.7 milligrams of bromine. That could be it. It's unclear how else I'm getting this other than it's sitting in my bones or my tissues somewhere. Fluoride, I'm quite happy to see I don't have fluoride extensively. So this is my thyroid function test. You can see my TSH has been elevated for some time. This was both before and after using, or before using iodine and after using iodine. So here with my T3 was 2.4, very low. My TSH was high. So I started taking 3 drops of Lugol's iodine every day. And my TSH kind of remained the same, but my T3 is starting to come up and my T4 is starting to come up. And I'm hoping eventually my TSH normalizes. So it's an expected outcome. If you start taking iodine, you're finally giving your thyroid back what it needs. So the TSH will go up. It's going to produce more T3 and T4. So you're going to feel better. You're going to have more energy. You're going to burn more fat. You're going to have less cysts, less risk for cancer. But the TSH is going to remain high for some time until it normalizes and it's saturated. The thyroid is saturated. The pituitary is saturated. So TSH again
is a testimonial to that, Stefan. I was up at the higher than you, 7, 8, 9, and then it dropped down to 3.3, and now it's like 2 point something. So like, people don't let the TSH wag the dog.
No.
Well, it takes about months more, to have that normalized in most people. But the other caveat is you definitely have to take the selenium with it, because I've had several patients on, the iodoral, and their free T3 really tanked. So again, it just still has to be coupled with the selenium. That's really, really important.
I put a bunch of references out there on the chat on the selenium component.
Yeah, Brownsteins suggests you don't need that much selenium, maybe 200 micrograms. It's not like iodine where you need so much. And the reason is, why would I
But if you're taking, 25, 50 milligrams of iodoral with no selenium at all, then that's problematic. Yes.
Yeah. You should get some selenium, and most multivitamins, you'll see it'll have 100 to 200 micrograms of selenium in there. So most multivitamins can cover people for that.
Mercola just put an article out on the multivitamin today. He recommends it.
Good.
Yep.
Yeah. So why might I prescribe this? Well, to detox someone from halogen toxicity. I found out quite strikingly that I've been prescribing people, the Atrovent inhalers, the ipratropium bromide. It literally has bromide in the name. I never kind of put this together because I thought it was safe. I was like, I've been telling people to breathe bromide in. So we're all learning here.
Yep.
What lab did you use for your 24-hour?
Yeah, you're looking at doctor's data here.
Okay.
Yeah, this is a doctor. This is a female. She's had let's see. Oh yeah, she's had birth control. So she had birth control for a while, and she developed hypothyroidism. She was on 120 micrograms of NP thyroid, feeling more fatigued and brain fog. We kept on increasing the dose of NP thyroid. So we had her start taking iodine, and so we're gonna have her continue doing that. We're gonna monitor these levels here. And hopefully she can start reversing some of this, and we can reduce the dose of the NP thyroid.
Right.
Essentially, these prescription medications, they should work better if we give them back some iodine and selenium.
Absolutely.
All right, this is my pee there. So that's what it looks like.
Did you drink it?
No.
I'm just kidding.
I know a guy. If you want him on, he can tell you all about that if you want to bring him on the show.
Yeah. Oh, we know him. Know him very well.
This is a lady, she had a strikingly low iodine challenge. So this was the cheaper version of the test. You don't get the halogens like bromide and fluoride. We just had her do the iodine challenge. You can see her pre-sample was very low. It was 0.09, under the reference range. And she's only excreting about half of her iodine that she took. So she's holding on to at least half of that. This is a lady who needs a lot. She's had a lot of toxic exposures in her life. So we're going to monitor her for improvement. Here's more if you're interested on the ineffectiveness of fluoridation, if you don't believe it yet. It's crazy enough, when I was a PA student back in my pediatric rotations, my job was to ask the parents if they were on a well water system or a tap water system. And if the answer was a well water system, I'd have to prescribe the children fluoride tablets that they would take every day. And the idea was that it was give them less cavities, right? It may work in some rural or urban populations that don't eat a very good diet. I think that's where that data is based off of. But if you can give them a good diet, they don't need that fluoride. It just causes more problems than it fixes.
You know, what's interesting, Stefan, is that, you know, I always worry about significant figures. So if by some strange coincidence, 1 part per million is the researched ideal dose. Who would have thunk it? 1 part per million. When I see a number like that, I say, there's no science behind this.
Yeah.
It's a wag, wild ass guess.
Wild ass guess.
Yeah.
Convenient to put 1 ppm in there.
Yeah, so vitamin C, that's what Brownsteins suggests. He says you take vitamin C when you're taking higher doses of iodine, because some people can get a detox reaction from the halides. I've seen it happen. They feel kind of miserable and they want to quit. But give them some vitamin C, make them hydrate well with electrolytes, have them take a B complex, and it can help them detoxify things. Have them take them some selenium. They don't need too much. You can get toxicity if you take too much selenium. So like 100, 300 micrograms, that's kind of all you need. Here's another one, kind of low end, pre-sample, excreting 72%. So we're going to keep her on at least 12 milligrams of iodine daily. Here's some references for you guys. You can purchase Lugol's iodine off of Amazon. It's like $12, $15. Here's some more references. And here's some of my information where we're active. Put this in the chat. We've got a lot of questions in the chat.
We get a lot of questions. Just one comment on iodine. You know, iodine is the molecular, then iodide is the reduced form. So it'd be like potassium iodide, sodium.
Yes.
And what Dr. Rozoff said is, you know, you can ultimately, and the feds supplemented with just the iodide, not the iodine, so the salt. And, you know, I don't think it really matters which one you take in, because your body will convert it to whatever form it needs. It's pretty easy to be oxidized and reduced. That's what makes iodine kind of a really special molecule in terms of it's where its redox potential lies. So, I mean, I use iThyroid because it's available on Fullscript, but someone mentioned the Terry triiodine, and it has iodine from kelp, but then it has sodium and potassium iodide. And I think at the end of the day, you know, like, we don't have to take sodium and potassium at the exact ratio of the sodium potassium pump. We just need to have sufficiency, and our body will figure it out. But yeah, there were a ton of really good questions. Let's see if I can start from the top here. So Steve mentioned, Steve, you want to hydroxy apatite? It looks like apatite.
Apatite, hydroxyapatite is exactly the way it is.
Is a bone and tooth enamel promoter. So rather than fluoride, yeah. I mean, it's a crime. I mean, there should be a big hearing on fluoride coming up in January. They've been dragging their feet. The CDC, NIH has all the data showing that it has a significant impact on brain development, and they're kind of pocket vetoing this thing. But the ICAM is suing them and others. So we might actually see some slow change, the Titanic steering a little bit away from the iceberg here in the next year.
Bromide, that's good.
Where can we get non-contaminated seaweed? Yeah, someone mentioned a Maine Coast product. Iodine dips with water and sea salt changed my life and cleared acne and facial breakouts. Sinuses were vastly improved. There's the antiseptic. I do my iodine nose spray now almost every day.
Yeah, that's awesome.
Oh my gosh. I've been sniffly. I had really bad allergies. Like my nose was like red and almost bloody in my teens, and it's always been a little bit tweaked. But the iodine, the only thing that's really given me great clarity. What about the impact of something like Biosil on TSH? Does Biosil artificially depress the TSH levels? I don't know what that is. Maybe either you, Stefan, or Dr. Carter does. Michael, Biosil?
Oh, Biosil is a silica-based product. It's supposed to be very good for, growth of nails and hair and so forth. Also, it's touted in some circles to help with detoxification of aluminum. However, if you listen to Dr. Christopher Exley, who is the aluminum man, that is not nearly as effective as drinking the natural water that's high in the silica, like Fiji water or Volvic water. And then, of course, their brands over in the UK, because he's from the UK. But I don't think it has that much, of an effect on thyroid function, as far as I know.
Stefan, someone asked, I lost it, it went away. Someone asked about after the Biosil, how do you detect bromide? I mean, the test, your urine test you're doing looks like it detects bromide.
Yeah, that's the only way to do it is with the iodine challenge test, because you have to dislodge the bromide from your tissues. The bromide and fluoride, they're higher up on the periodic table. So they're just going to sit in your tissues. You can't easily measure it in the blood unless you are dislodging it from your tissues with higher doses of iodine. Then it's going to appear in your urine.
Right. What I'm doing, I'm having everybody do the Brownstein protocol, which is 25 to 50 milligrams, 4 days a month. And then what I'm telling people, because everybody's a little squeamish, I'm telling them when they're not doing that protocol, do at least 1 mg. But we published a blog, Dr. Carter and I went through all the analysis. And in my opinion, the optimal level that won't make people freak out is around 3 mgs a day. But I don't have any problem going higher. And any comments on dosing?
Yeah, listen to how the patient's feeling. If they are getting a detox reaction from that, they have to back off on the dosing. They have to do more B vitamins and higher doses of vitamin C, right? They have to take a bit of selenium, and they have to slowly build up back on the dose of iodine.
Right.
Have you seen anybody having like tachycardia or anything like that when you give them the iodine?
No, I have not seen that. I mean, even on patients on thyroid medications, I tell them, look, you may need less of this thyroid medication. So like break your NP thyroid in half, take half of it and take some iodine, see how you feel. If you feel a little bit of fast heart rate and you stop the thyroid medication, just take the iodine, because it may be you were just deficient in iodine the whole time. So, and then, but if they feel weird and they're not on thyroid medication, they're probably detoxing from toxic halogens, and they just need to go slower on it.
What I'm telling people
is that 3 milligrams, Dr. Lewis?
3 milligrams, yeah. What I'm telling people to do that are starting the Brownstein protocol and have never really taken iodine other than the is I say start with 1 milligram and double it every day, more or less, to work your way up. And if you feel something like the detox, I mean, stay there or back down, but don't. It's all about adaptation. If you're not good things are harmful too if we're not adapted to it. Like
absolutely.
So
I've had one patient who did get tachycardic, but they were also on thyroid medication, and absolutely, had them decrease the thyroid medication, and that definitely. I had them also decrease the iodoral. So the
that's
iodoral.
a good point, Michael. I gotta put that in there.
Yeah, of course.
I gotta
Yeah,
put
it's
that as well.
you know, 6.25, 12.5, and 50 milligrams
Yep.
tablets. So it's always good to, and some people, especially, if they're very sensitive, to start with the smaller dose tablet. And of course that can be broken in half. And then, you can, kind of ramp up with it. So that works pretty well.
Okay, next question is, will men benefit from iodine supplementation if they've already had a prostatectomy? Will it prevent recurrence?
Yeah, I mean, men can get breast cancer too. Men can get thyroid cancer, right? But there's a lot of reasons why you would want to take iodine. It's going to be critical towards your thyroid hormones. Your thyroid's connecting to all your tissues and hormones. It'll improve your testosterone levels if your thyroid's working better. So of course, you need to make sure iodine's sufficient if you're a man.
So,
Absolutely.
just to give you an idea, I didn't, I know that the T3 and T4 are the energy hormones, but I didn't quite understand where they played into mitochondrial function. But we published a video. We didn't do it, but it was some other doctor published a 5-6 minute video. It's out there on Rumble that explains how T3 plays a role in the recycling of different constituents of the electron transport chain. So, in my quest to find what's rate limiting athletically, you get carbohydrates, you get your VO2 max, but your VO2 is related to how you can convert carbohydrates to carbon dioxide and oxygen to carbon dioxide and water in your electron transport chain. So I've been toying with CoQ10 only when I don't take CoQ10 normally, but during competitions, and low dose thyroid hormone along with it. And I'm doing too many things at once because I don't want to wait forever to figure out how this works. But I have an inkling, Stefan, and I think it's well published, that you get rid of iodine through your sweat as well as your urine. So the more athletic you are and the more you're out working, probably you need some supportive, for maximum output, you probably need some supportive thyroid hormone to go along with it.
Yes, this is confirmed with my research here. So some of the lowest patients I had were athletes, like high-performing athletes.
Exactly.
Where are they? Yeah, this is athlete, low testosterone. He's 28, one of the lowest ones I'd ever seen. There were some bodybuilders here too. Yeah, a bodybuilder here, 35 and 29, super low.
Brilliant work, Stefan. It's out there in the literature but only if you know which questions to ask. If you don't ask that question, but so I really think you need the iodine, but you may also need a little supportive thyroid hormone under extreme competition. That's all.
Yeah.
But I mean, the point is it applies to everybody, but I don't take it when I'm just sitting on, as we say in Poland, my dupa all day long like I am today. I'm not taking any kind of supportive thyroid thing. I am taking my iodine and the selenium.
And this is why I don't recommend testing a serum iodine if you're taking Lugol's or something like that. It's going to increase the serum and it's going to be off the charts. You need to do iodine challenge tests and urine testing to assess dose after you start taking iodine.
Right.
Okay, let me just see where the chat went. I've lost it. There were a couple of good questions. This is brilliant. We actually answering questions today. Has it been mentioned anything in circulation bind to the iodine? That was kind of a follow-up on the men and prostate health question. So did you get that question? Anything in circulation that binds iodine? I think that's the question.
Binds iodine? No, I don't know of anything in circulation that binds
Steve,
iodine.
if you want to clarify, feel free to come on.
Yeah, I mean, like sex hormone binding globulin, binds testosterone, etc. I'm just wondering if there's anything that would bind the iodine where it might show up in a total iodine blood test, but in reality, it's not available for utilization in the body.
No, proxy markers is the best you have, looking at T3, T4, and IGF-1 levels.
Okay. All right. Thank you.
Joy asks if there's benefit to just daily painting of iodine on the inner arms rather than taking it orally.
Yeah, I know it absorbs through the skin, and you can see patients getting improvements. So there must be systemic absorption in it. I don't know what have a measurement of that. I don't know how much you're absorbing.
Joy, just so you know, because I'm my N of 1, and with my eyes, I'm an N of 1 and the control. But I've been accused of consuming a lot of nicotine, because every once in a while people see me with kind of yellow hair. That's an iodine. I'm doing an iodine rub, just like we're getting Demodex around the eyes. We have mites everywhere. So I've been doing some iodine on my scalp and hoping it absorbs into my head as well. I can see Dr. Carter with a very curious look at me, but you know, it's on the skin. It's not under the arm. It's on my hair. How do you make your nose spray? No, I go to Iodine Products, and he calls it I don't know, I can't remember the name of this, but immune defense or something. It's on our blog, Gene Rosoff. If you go to the blog and just put in iodine, you'll find some of these things. So yeah, he makes up a 1% spray and it works really well. He gave me a 2% spray once. It's a little too potent. So that's Gene Rosoff, Iodine Products. He was censored by the FDA, so it's like he's kind of stealth now, but he says call him anytime, and his phone number's out there. It's like within the top 10 most recent blogs I put. Where can we access the replay? If I don't just trash it while I'm uploading it this time, you'll be able to see it in the next couple days on our Rumble channel. So you go to our HRP and then just click on the little Rumble icon in the menu. What is the concentration? Pretty much what Gene does with the iodine roll-on and the iodine eye drops, which I don't think he's selling, but I'm trying to get him to. It's 1%, and at that level there, minimal stinging, not bad. So, and then we're gonna have the iodine. I'm loving that stuff. That's why I'm using it, going beyond that, Steve, and putting it everywhere where you might have a little skin issue. What benefits are you seeing from the iodine rolling? I don't know yet, Joy, but the main thing I'm treating is my toxoplasma gondii in my eyes. But my son told me, and I almost had to kill him. He says, Dad, you have Demodex, which is a nasty looking mite. And so I'm hoping to see that go. But look, the eye is it absorbs a lot of stuff. It's a vector into the body. And so I'm just trying to keep that whole area clean. That's all. And with that, I'm going to have Dr. Harshfield come on. See, nascent iodine, if the iodine, molecular iodine, isn't red-orange, it ain't molecular iodine. You can't separate an iodine into, it's a diatomic triple bonded molecule. So if it is not brown-orange, it's iodide, which is not bad. I mean, there's nothing wrong with that. You know, your body will use it. How do you make the topical solution? You don't know me, my dear. I pour a little on my hands, 10% povidone, and rub it on. That's my fancy preparation. Liquid mask. Thank you, Joy. Thank you. The name of Gene Rosoff's iodine sinus spray. Yeah, liquid mask. Thank you. And with that, Dr. Harshfield, come and land the plane.
Thank you again. We had talked, I think, about, as a radiologist, I'm always focused on what we give our patients, and iodinated contrast is something that has been given for decades. It's really interesting that there was an issue with iodine allergy, which is kind of silly, and it's obviously the chemical in the pharmaceutical, the iodinated contrast material. Of course, being a radiologist, I could never say that. We had to pretend like these patients were allergic to iodine, which they weren't. And a professor in, I think, Wisconsin, Dr. Mellons, convinced 25 people that almost died after iodine contrast injection for an IVP, intravenous pyelogram. He convinced them to let him inject them again. Now, this could never happen today, obviously. Not a single one had a reaction. And he realized halfway through that he was doing patients that had been done at a VA hospital with a certain cheapest contrast available. And he had them come to the university across the street to the nicer level iodinated contrast. So it was a different company. So then I started thinking, people have renal disease, have a hard time excreting this contrast material. And I'm wondering, kidney function, obviously the 12 systems, we're talking about the endocrine, the other 11 are paying attention to this iodine issue because it's so part and parcel to metabolism. My thought is that there are a lot of folks that have renal dysfunction that are going to have iodine issues. And then, and not only that, to your point, Stefan, that fluoride has a higher affinity. So it's even harder to pee out the fluoride because it doesn't want to go out to the urine. So, and then the gastric absorption or malabsorption, when people are taking these proton pump inhibitors, can't get their stomach acid acidic enough to absorb their iodine. So we got a couple of things we ought to look at when, and I didn't see that addressed it in your patients, but I'm sure you look at their urinalysis and their lab work for renal function. And then also the question, you're on a proton pump inhibitor because you're not going to absorb iodine without that.
Without stomach acid? Is that what you're talking about?
Yeah. When the stomach acid's not high enough, and a lot of that's prostaglandin. It's really interesting how that works, but you can't absorb your iodine. And then the cascade of events that happens, if you do absorb your iodine, great. It gets to T3. And if you don't have selenium, glutathione, a whole bunch of other little key elements, T3 doesn't go to T2. So the mitochondria don't see their little active component. Just kind of in observational thought of that, folks, my iodine's not working. Okay, your thyroid is the center of that, but it's the canary in the cave. You probably have issues in one of the other 12 systems, that endocrine system being one, the other 11. And is that something that you guys look at a lot? Because I don't treat a lot of folks with iodine in my practice. I know that's an issue. We use Lugol's. It's so simple to do. Put it on the sole of your foot or your palm of your hand. It's absorbing. When it quits absorbing.
I mean, I try to keep it really simple for people. If I can just get people to start taking iodine, I mean, that's we're winning there because everyone's deficient in iodine. And taking it as a bit of selenium, a B complex, some vitamin A. I mean, that's just icing on the cake. But I have to keep it really simple for people, otherwise it won't follow directions. If I can get the message out that they can just do some iodine drops or eat some kelp, we're winning here. Got
it. And one last thing is about, you were talking about placental malformation with iodine deficiency. One of the biggest causes of miscarriage is the placenta is small or misshapen. And we were looking at it being a vascular problem. It could very well be an endocrine problem. The placenta is never properly developed. And then the ovum has got microtubules in it that require iodine to form the little cytoskeleton. So not only is the placenta at risk for lack of iodine, but so are you, because we're all ovums, right? We start off as physics, and at some point in time we become a living person with a conscious. Iodine is key to that transition.
Brilliant.
What do we think about iodine and renal disease? I mean, to me, I think particularly when I see the liver enzymes, which is not renal, elevated, there's some type of infection going on. So I think iodine is a very critical thing to take. But why would we be concerned about renal disease and iodine?
In folks that have poor renal function, we can't give them the IV contrast. And admittedly, that's a huge bolus of iodine. Yeah. And also, if you give an IV contrast to somebody for 6 months or to a year, their thyroid function is going to be messed up because you just flooded their thyroid gland. Although probably, Stefan, to your point, they're probably full of fluoride anyway. They're protected.
They need it. But I wonder.
Yeah, I agree.
In that stuff, because it often gives people allergic reactions, right? Allergic to IV contrast. And what else is in that junk? We don't. I'm not quite clear.
Yeah.
Well, we know the vaccine's clean. Oops.
Oops.
Yeah, yes.
Oh, and also there's people running around with iodine capsules so that when the nuclear bomb goes off, the whole deal is take the iodine to protect your thyroid so it won't absorb the radiation.
Yeah, exactly. This is actually the treatment for a nuclear war. It's 50 milligrams of iodoral.
Okay.
Yep.
Thank you, Stefan. Amazing, and I think really important fundamental information. I mean, what's less expensive than iodine? You know, selenium, you go on, I mean, you may not like this brand, but you go on Swanson's and you get a 2-month supply for like $2.39.